Hello everyone, we have some great questions once again. We appreciate everybody asking the Dr. Bob questions, whether it come from YouTube, Facebook, Twitter, just emails, and they're always very intriguing. My 14-year-old daughter and my 17-year-old son occasionally tell me that they have vomited a small amount in their mouth. Very interesting. This has no relation to having just eaten or eating and lying down or any of the usual that you would suspect for this. I can tell you from my experience, anytime there's any regurgitation that comes back up into the throat region, I normally think liver gallbladder. And I can tell you, just knowing the ages 14 and 17, we really start to see liver gallbladder congestion when someone's about 12 years old. What kind of fast food are they eating? Are they drinking soda pop that has bubbles with it? But it comes down to liver and gallbladder. What is the ranking of children? Are these the only two that you have? Once again, that regurgitation, liver, gallbladder. Does your child have challenges with radishes, onions, garlic, cucumbers? Those are body signals to me for liver gallbladder distress. We would suggest at least a half a red apple every day, third cup of beet fiber, and 4 or 5 baby carrots or 1 medium carrot. They said then, most important, the last few days my daughter's breath smells like vomit. So that would make me also think of some digestive distress, but liver gallbladder would be where I would suggest. Dr. Bob's ABCs. Hey Dr. Bob, I have a question. I always get really cold after every meal. Do you know a reason why this? Just asking. Well, I would have to tell you this. It's very possible you could have a low thyroid gland. See, when your fingers get really cold, we call that Raynaud's. Very common with subpar thyroid. Altered blood flow. I know that when you eat a meal, the blood's going to go to your stomach to help the digestive process. So I would suggest a TSH, T3, and T4. It's TSH, T3, and T4. Those are blood tests for the thyroid gland, and you would treat that accordingly. That's one of the thoughts that I would have. Now, this individual had a lot of information about female hormones. She had a hysterectomy. They left her ovaries. She had vaginal dryness. She was talking about her estrogen levels. And finally, they told her that she had vaginal atrophy and wanted to know what I would suggest. She said she ate the Dr. Bob's ABCs. Here's what we know. More than likely, you have low estrogen. The adrenal glands need to be supported. There's a test that we do called the Adrenal Stress Index. It's a saliva test. It's probably the most accurate way for me as a drugless doctor to help you determine your hormone levels in your body. We need to support the adrenal glands. That's critical. It's all based on the Adrenal Stress Index. You can also have your blood pressure taken from a sit to a stand position. The blood pressure usually drops from a sit to a stand position with people with exhausted adrenal glands. So we need to support that. But in our practice, we use Emulsion Forte, 4 drops 3 times a day. Emulsion Forte, 4 drops 3 times a day, plus we would support adrenal gland function. The adrenal glands are important to help make hormones, which in turn will help your vagina not have an atrophy issue. I've heard about the concept about eating for your blood type. What do you think about this idea? I can tell you from my experience and from reading Bruce West and the Health Alert, it's about 30% effective. What we have really seen is if you have digestive distress, altered digestion, especially in your large intestine, will impact the undigested food particles that are in your body, which has everything to do with your body's impact with the food that you're eating. So yes, we've had great results with some individuals, and some people it does not make any difference. I can tell you also that people with blood type A, alpha, tend to have more digestive distress with certain items than people who have blood type O. I really have bad breath. Can you help me? Well, what we have noticed with people with bad breath issues, besides oral hygiene, And by the way, I use a product called Agricept L. It's a citric seed extract, 10 drops in 4 to 6 ounces of water, and I swish it in my mouth. I've had a conversation with dental hygienists that have told me that over time, arthritis and other heart challenges could be directly related to oral hygiene. Oral hygiene would improve, make sure you're brushing your teeth. But your stomach is nestled here in your abdomen, and the exhaust pipe is your esophagus. And if you have really bad breath, it's coming continuously, it could be that you're combining your food wrong. If you're going to eat animal tissue, you don't have a starch with it. That means steak and potato really is not healthy. Even pasta with meatballs, really not healthy. Even a sandwich, physiologically. I would never eat fruit at the end of a meal. I would not use ice water with a meal. It all stagnates digestion. You might want to cut back on your animal tissue. I would not use dairy products with a meal. You have faulty digestion. If you're over 40 years old, you need a digestive enzyme, because most people do not have enough digestive enzymes in your body. I've noticed spots in front of my eyes and just heard that aspirin can cause eye problem. Any help? Yes, I read an article recently that aspirin might be one of the leading causes of macular degeneration, which is a breakdown in the back of the eye. But I also have noticed in my practice, you may have little floaters in front of your eyes. They call those vitreous floaters, and we've had great success with carrots. 1 medium carrot every day will go a long way to helping those eye floaters. Really, it's more than likely a liver challenge. And my very last question. Someone asked us about the HA1C. What are the normal values for HA1C? Well, the HA1C is blood glucose on a red blood cell. You want to look at your normal range, but I know this, you want it less than 6. And I can tell you that my HA1C is checked every June for health insurance. It's very, very serious today. You want your HA1C to be within the normal range of the lab that you're using, usually below 6. We appreciate each and every one of you, the questions. Pass this information on, pass this link on. We're here to make a difference for you.